So first we'll get started to hear from Dr. Erica Nason, who's an associate professor in the School of Social Work at Texas State University, as well as a faculty fellow in our Translational Health Research Center at the university. I'll hand the conversation over to Dr. Nason to get us started.
Hey, everybody. Thank you all for taking some time on your lunch break. I know we all have busy schedules, and I appreciate you being here for this discussion about how we can incorporate social support and strengths from social support into our existing healthcare models for mental health. I know that many of you are likely involved in work directly with veterans or active duty service members in mental health. So I'll try not to kind of spend too much time on background, but we'll cover some of that because I know we do have a mixed audience. And if you want to go ahead and go to the next slide, that would be great. So as Lauren said, I'm an associate professor here at Texas State in the School of Social Work. And I think my interests in how social support could really be incorporated into mental health care began way back as a graduate student at the University of New Mexico. I was in a training program that was pretty oriented towards empirically supported treatments, and a consequence of that is that a lot of those care models are traditional psychotherapy models. So one-on-one, individual therapy, group therapy modalities. And I really began to kind of think about how social support could be harnessed towards enhancing existing treatments or potentially even kind of developing new ways of approaching mental health. When I worked in a position on a small clinical trial, using small group treatments for women with PTSD. And I really kind of started observing within those sessions just the power of that social support. So it was a lot more powerful for these women to hear from one another, feedback on their own, traumatic experiences and those types of things. Hearing it wasn't your fault. Hearing you did everything you could was just so much more powerful from their peers than it was from us as therapists. And there was also kind of this quality to the sessions where the witnessing of one another's traumatic events and witnessing of one another kind of processing through those traumas and really kind of working on the mental health symptoms that just seemed really important and really wasn't being captured in a lot of the coursework I was doing or kind of the traditional supervision I was receiving. I went on to work at that same VA as a predoctoral intern, so kind of our equivalent to like a medical residency, and spent a lot of time on a rotation doing inpatient treatment for comorbid PTSD and substance use disorder. And there again, I really kind of observed some of the powers of social support. And so here it was a lot more peer-to-peer social support. So watching individuals in our milieu who had been in treatment with us for longer periods of time, kind of mentoring some of the newer patients and helping to kind of create buy-in for some of the treatment approaches that we were using. After that, I spent some time at what is now Fort Cavazos doing clinical trials for PTSD and related combat associated disorders. And those trials were kind of more within that traditional treatment framework, but there were kind of these opportunities for really thinking about like how our service members could communicate what they were doing in treatment with their family members. Occasionally, we'd have family members come in for a little bit of psychoeducation and those types of things. And as I've transitioned into a faculty role where my focus is less on direct clinical care and really more on research and teaching, I've continued to really think about this idea of social support and how we can kind of extend those strengths into the treatment and the clinical services that we provide. I'm going to pause and let my co-presenter Hannah introduce herself a little bit. And then as Lauren and Shelby said, I'm going to talk a little bit more about the research side. Hannah's going to provide some case study discussion, and then we'll open it up to everybody. So Hannah.
Thank you, Dr. Nason. Hey guys, I'm Hannah O'Brien. I am the program director of an organization called Veteran Spouse Network. We actually operate out of the University of Texas at Austin School of Social Work. That's where I got my degree. You'll get to hear more about me personally in the case study portion and the work that we do. But I am also a veteran spouse myself. My husband is a Marine Corps veteran. So similar to what Dr. Nason was saying, like, I've had a lot of connection to this community personally and professionally, and very passionate about supporting the family members. So we'll get to hear about how they fit into social support. Back to you, Dr. Nason.
All right, we can change slides. I was going to start with a little bit of background that might be familiar to many of you who are in direct practice, but I just wanted to make sure everyone on the call with diverse backgrounds has the same framework for thinking about military mental health. And I think the first thing, and maybe one of the most important things to note, is just that military communities are exposed to a lot of really unique stressors that other communities may not be familiar with. So the most kind of obvious might be combat exposure, but there are other types of stressors that can have a real influence on mental health and our social relationships, such as kind of deployment cycles that might take people away from loved ones for periods of time. The other key thing here is that there are really high levels of resilience in military populations. So despite exposure to all of these kind of unique stressors, many military members never experience mental health problems, and many might experience short-lived kind of mental health stress, like many of us do, that kind of resolves or returns to baseline on its own. This talk's going to focus a little bit more on folks who fall into the category of having more serious mental health diagnoses or more long-term mental health consequences. And three of kind of the most common mental health disorders within the military community. First, PTSD. We hear about this all the time. It's the most common mental health diagnosis for our military, active duty and veterans. About 10 to 15% of soldiers who have deployed to Iraq and or Afghanistan meet full diagnostic criteria for PTSD. We also see high rates of alcohol and substance use disorders. Within active duty military, about 3% will meet diagnostic criteria. And among veterans, that number is going to kind of ooch a little bit higher. And we also all probably hear a lot about suicide in the military. This is a real concern for a lot of reasons. First, suicide is the second leading cause of death in military personnel. And we see high rates of suicidal ideation. So even in folks who might not make a suicide attempt, about 1% of our soldiers report some suicidal ideation. So we'd love to see that number decrease. Across all of these disorders, we have lots of research that really shows the relationship between social support and mental health. And we're beginning to kind of learn more about third variables that could function as mediators between the relationship between social support and mental health symptoms. So things like emotion regulation, for example. And we can move to the next slide. We have excellent treatments available for PTSD, substance use disorders, and suicide. And those are available and are kind of rolled out on large scales at VA hospitals, at all sorts of clinics within communities. However, there are kind of limitations despite the strengths of those treatments. One of the most notable is that they only work when people are willing to use them. And we know that about a third of service members with mental health diagnoses don't seek, or only about a third seek treatment. So that's a huge proportion of individuals that are just kind of missing, the net's missing them when they come in with these traditional models of mental health treatment. And so I think spousal support in particular could be a really, really important area for research to continue to explore. And there is a growing body of research around social support and spousal support in military mental health. It's just not as far along as some of the research on some of these more traditional kind of individual psychotherapy types of models. We know that spousal support is associated with better mental health outcomes, better mental health functioning among active duty service members. And we know that both military members and military spouses both report wanting to be involved in this mental health care. So military veterans want family members involved in even forms of traditional mental health treatment, such as means restriction around suicide prevention. And military spouses, and I think Hannah's going to talk a lot about this. This citation comes out of her program. They want to be involved in service member healthcare, and they often don't know or kind of where to begin or where to seek those supports. And so I think that's a really important gap that researchers should be thinking more about. We can transition to the next slide. I'm going to kind of move quickly through some of this, but what we mean by social support and where we can potentially leverage social support is diverse. So some of these we already see kind of in action regularly. Others might kind of need a little bit more attention. Military units, both horizontal and vertical structures, can be useful, so that peer-to-peer battle buddy military support, as well as kind of training officers or unit leaders in ways to help support the mental health of their individual soldiers, can be a really great way of looking at this. There's lots of different group therapies, therapeutic milieus. We see peer support specialists often in the VA. We have peer support specialists. Substance use disorders and treatment for that is really kind of a place where we see that a lot, but I think we're seeing more peer support specialists kind of in different roles. We'll be focusing, like I said, on family and significant others, but then also our four-legged friends and animal-assisted therapies. I'm kind of lumping that into social support because they're important members of our family, right? And you can go ahead and change that slide. And we do have kind of different models of integrating social supports. Some of these we see more often. Some of these we see insurance being able to cover. We kind of have better access to, and some we might need to kind of think about how to flex our models to accommodate. So traditional couples therapy has been around for a really long time. It's often more difficult to access than individual treatment. And when you look at social workers and psychologists, large proportions of those types of mental health facilitators say that they don't get enough training in those areas. So that might be something to kind of be thinking about as well, kind of how we create providers who are more comfortable incorporating social support. I think informal integration of family sessions within individual treatment. This is something I did fairly often when I was at Fort Cavazos. So inviting spouses to maybe a session to help them understand what PTSD is, what the treatment's going to look like, what they might kind of expect, and how they can support their service member. We've seen interventions for families throughout the deployment cycle as a way of kind of increasing that social support. The next one is kind of ongoing work at Fort Cavazos and elsewhere, creating these weekend retreats. So understanding that it might not be feasible for everyone to come to a session once a week for 12 weeks or something like that, and being able to kind of compress some of the treatment into a weekend where a spouse and their family member, their loved one, can come and do a really intensive process to support their mental health. Sometimes logistically that kind of works better with the lives, especially of our service members, where they might not be always able to kind of get out of work or other obligations. And then this kind of touches on Hannah as well. So not only thinking about the service members or the veterans with kind of mental health symptoms, but also thinking about how to outreach to those family members and kind of provide separate supports in that domain. We can change slides. So I'm going to just touch really quickly in these slides on some of the kind of existing research on social support and PTSD, substance use, and suicide. One of the things here is like we kind of know, and I don't think this is just true for PTSD, it could apply to all of these disorders, but there's really this bidirectional relationship between social support and mental health functioning. So we have different models, the social erosion model, where mental health symptoms kind of can contribute to a decline in the quality of social support in an individual's life. But we also kind of have models that suggest the opposite. So individuals with less social support prior to experiencing a stressor or, life change are also more at risk for going on to develop mental health symptoms. So we have this real kind of bidirectional focus. And social support, I think with PTSD is really important in kind of addressing all of the symptom clusters that we see. So just thinking about avoidance, for example, one of the hallmarks of PTSD, oftentimes family members will see how distressing it is for their loved one to enter into maybe a crowded space. Like it's difficult for them to go grocery shopping, or it's difficult for them to go support their children's sports teams or things like that. And so the spouse will kind of do what's helpful in the short term and accommodate that avoidance, right? So they might take on the grocery shopping. They might engage in strategies for like helping the service member not attend the child's sporting event, right? They might videotape, they might do other kind of compensatory behaviors. And that's helpful in the short term because that helps decrease the immediate distress. But in the long term, we know that that avoidance can kind of help maintain and build the PTSD symptoms. So that's one area where kind of having spouses on board and kind of understanding how PTSD treatment might be working could be really, really important. Next slide, please. Substance use disorders, I think, are a place where a lot of models do incorporate social support. Even thinking about like Alcoholics Anonymous, that's a place where we see, a very, very peer-focused, community-based treatment approach. But we also see models, the community reinforcement approach. That's something we don't see as much in the United States, but in Europe, we see being implemented with a lot of effectiveness. And so kind of bringing in family members and helping the family member to understand how to differentially reinforce sober behaviors and not the using behaviors. So sometimes what happens with substance use is family members might be angry about their partner's spouse or partner's substance use. And as soon as the spouse becomes sober or kind of engages in sober behaviors, that might be a moment where that anger is vented, right? And so kind of helping family members to navigate how to support sobriety, but not kind of help maintain the use. We can move to the next slide as well. And then suicide prevention efforts. We know that most of our suicide prevention efforts within the military and just generally target individuals who are at the highest risk. So if we kind of flag somebody as being at imminent risk or having really high levels of suicidal ideation, most of our intervention efforts focus there. And that makes sense. We definitely want to kind of target people who might be at highest risk for suicide, but this potentially leaves this gap for people who are at low to medium risk and might not be accessing or have access to the same types of supports. One of the kind of common interventions within military units is these gatekeeping interventions. So training key individuals, chaplains, unit leaders in suicide prevention interventions and helping them to become aware has been shown to be a fairly effective approach. And then linking back again to some of the content that I think Hannah is going to be talking about in just a moment. Just re-emphasizing some of the points that we made earlier, that veterans want this sort of social support within their suicide prevention plans, within their suicide prevention interventions. And that military spouses are also very much wanting to be kind of present and learn and know how to support their loved ones. And then next slide, I think it'll be my last. So thinking about kind of next steps for research, social supports can be used in so many different ways. They can be used to reinforce and inform existing treatment models. So for example, prolonged exposure, cognitive processing therapy. We can use social supports to really kind of help move those forward and enhance the effectiveness of those. We can also use social supports to just decrease the stigma. Stigma is a huge barrier to mental health treatment engagement. And given that statistic about like we only see about a third of folks who could benefit from psychotherapy, figuring out ways where concerned significant others can really kind of support and decrease stigma, maybe increase the likelihood that somebody will engage in treatment could be really important. I also think social support can be kind of harnessed at all points of kind of the mental health intervention spectrum. So we can definitely kind of look at ways of using mental health supports to prevent the onset of mental health disorders, as early intervention tools for individuals who might be at risk for developing symptoms, and then of course during treatment as well. The next piece is like we really kind of need to decrease one of these barriers, right? Which is we just don't have many scalable models for dissemination in clinics. Our clinics aren't necessarily designed for family members or incorporating social supports. And so starting to think about from a dissemination perspective, like how do we train providers? How do we create clinics that could potentially accommodate these types of interventions as well? And so I guess in conclusion, as I'm handing the baton to Hannah and poising us for our full community discussion, I just think there's so much potential for research in this area to not only kind of enhance the existing treatments, but begin to develop out of the box new modalities that can help support our military and our veteran mental health. And so I'm going to hand it to you, Hannah, and look forward to the conversation with everybody.
Okay. Thanks, Erica. All right, you can take us to the next slide. So I know you got to give y'all a little intro and like so much, I mean, we designed it to be complimentary, but so much of what Erica shared is like spot on to what we hear with our own population. So as I mentioned, I'm a program director for an organization called the Veteran Spouse Network. We actually operate out of the School of Social Work at UT Austin, and we're a part of a larger institute for military and veteran family wellness. So like we conduct a lot of research as well, and everything Erica said is spot on. Like there's a lot of lacking research in the area of social support, peer support, how to involve family members in care. And so, we do some initiatives there. But really the Veteran Spouse Network is more of our programming arm. So our mission is to facilitate a network of support for military and veteran families, really on the basis that in the military community, community is huge, right? They build these strong networks of support. And when they come to rely on those and when they transition out, those communities don't really exist. And they're kind of left feeling isolated. And so what we try to do across the whole spectrum of military life experience, so while families are navigating active duty life, transitioning out, and settling down in post-service veteran family life, really helping foster those connections and creating those communities of support for them. And we primarily do that through peer support. So connecting them with others who have walked this path. So we have group peer support options, one-on-one, and we also do some education and training on a lot of these topics Erica was talking about to help equip them with information and knowledge about like what is their family going through, what is their service member or veteran experiencing, and how can they support themselves, how can they support their loved one, how can they support engagement and care, and how can they be that advocate. So who do we serve? Just because I think that's helpful to know. As our name is Veteran Spouse Network, but we do serve active duty and veteran spouses, committed partners, family members. And for us, that definitely includes individuals who are divorced or widowed from service members or veterans. Those are populations who, when that loss occurs, feel very cut off from the community, but it's still very much a part of who they are and their support system and their identity. So being able to stay connected is really important. And then a lot of our training and education we provide to service members and veterans as well. Nationally, internationally, largely virtual, some in person. On the next slide, I'm going to show like a 90-second video just because I think it's a fun way to just kind of see a little bit more about our identity. I will caveat it by saying we recently created this video for a grant that was focused on women. So you'll hear a focus on women. We don't just serve women, although the spouse population is 93% female. So it is the majority of our population, but I'll have Shelby, you can go to the next one and I will be quiet.
Military and veteran spouses face unique challenges. They often carry the weight of family responsibilities, caring and advocating for their loved ones, and navigating major career and life transitions, all while coping with feelings of isolation and impacts on their mental and physical health. While service members and veterans have access to extensive resources, their spouses and families are frequently left out, leaving them feeling disconnected and underserved. At the Veteran Spouse Network, we're here to bridge that gap, and our mission is clear: to provide connection, education, and support to spouses and families, helping them improve their wellness and quality of life. Through tailored programs, we create spaces for growth, resilience, and connection with others who truly understand this unique journey. Whether it's through one-on-one or group peer support, education and training, or even a podcast or blog article, we equip spouses with the tools they need to thrive. This community is made up largely of women, and the Veteran Spouse Network is led by women, many of whom are military or veteran spouses themselves. We understand the experiences of this community because we are this community. And by incorporating the voices and feedback of our members, we ensure the support we offer is shaped by those we serve. The Veteran Spouse Network is more than a program, it's a movement, one that connects women across the country, creating a ripple effect to ensure that no one faces these challenges alone. Together, we're creating a brighter future for military and veteran families, one where every spouse has access to the support they deserve.
Thank you. We can go to the next slide.
Military and veteran spouses face
high level of a lot of what I'm going to talk about of what we do and how we do it, but also contextualize a lot of what Erica shared in that, like, what are we hearing, right? We're dealing with spouses and family members every day in peer support sessions and groups and crafting content to support their needs. So what are their needs? What are we hearing? We hear that they're struggling, right? And Erica mentioned this, like, as a possible social support solution is also just serving the family member, right? A lot of what we think is they deserve support. They're impacted by military life and veteran family life as well. But also, if you think of the family as a unit, right? If one member of the family is getting support, that's good for the whole family. And so sometimes when we see that the service member or veteran is getting treatment, and the family member is not looped in or is not really getting the care that they need, when they come home and try to implement some of those strategies that they learned, it doesn't always work. And they still have some of that, like, relationship distress and things, and then that kind of makes the treatment not as effective. But when the spouse is getting that support or roped into the treatment of the veteran or the service member in some way, there tends to be a lot more success for the family as a whole. But yeah, as individuals, they struggle, right? Military life is challenging. We talked about some of those things already, just, the transient nature, frequent, relocations, separation from your spouse, serving as a single parent, a lot of career and educational disruption for spouses, and a lot of social isolation, having to kind of recreate community when they move or when they transition out and are settling down as a veteran family. And then, of course, everything Erica talked about when all these mental health diagnoses are showing up, which can happen active duty. We see a lot of it come up as they're transitioning out and being in post-service life. These things start to show up in their families. And so a lot of spouses and family members are stepping in as caregivers in some form or fashion. And that could look as simple as, reminding my partner to make their appointments, or as serious as, they're severely wounded or injured and I'm providing like, literal care, logistical care, bathing, feeding. So it's a spectrum, right? And many of our spouses are somewhere on that spectrum, whether they realize it or not, whether they identify as a caregiver or not. And being in that role takes a toll, especially if you do not feel supported or equipped to take on these responsibilities. And as a result, a lot of times they face burnout because they're not getting the support they need while they're in these roles. But mostly they feel really alone in their experiences, especially post-service spouses, because they kind of left the military life. Or if you're like me, and this was an interesting statistic I learned recently from a RAND study, that there are actually, of the married veterans, more than half are married to someone they met post-service. So that spouse did not do active duty life with them. That's the case for me and my husband. I met him after he had separated from the Marines, and had no understanding of this community and what he had faced during his military service. And so I was way behind on the learning curve when I met him, trying to figure these things out. And there are a lot of us post-service spouses out there in these situations who feel very alone and very overwhelmed and very confused because we don't even know what is up or down. And so there's a lot of wondering, am I the only one who's dealing with this thing? Am I crazy? And if you don't have people to measure the crazy against, to tell you if this is real or not real, but common, and to validate it. You might be hearing from others in your life, as many are, who don't understand the experience, that are not supportive and are kind of telling them like, why are you dealing with this? Why are you putting up with this? Like, get out of this situation. And they're not getting that information, education, and support they need to stay in the relationship if they want to, and to understand how to support themselves and their veteran while they're facing things like substance use and abuse, PTSD, suicidal ideation, these very serious things that impact families and relationships and individuals, that are oftentimes coming from their service. And if that family member doesn't understand what's going on, it can make the situation for everybody so much worse. And as Erica said, they want to be involved. They want to be involved in care. These are some of the most have like serious advocates you would ever meet. They so often, we're trying to, in our groups and stuff, tell them, hey, this is a space for you to get your support. And it is so hard to get them to not talk about their veteran and supporting their veteran, because that's where their mind is. That's where they want to focus, is how can I better support my loved one, my partner who is dealing with all of these things, because I feel under-equipped, under-supported. I don't have the information, education, or resources to do this, but I want to. And they're navigating very complex systems of care that, as we mentioned, are not designed to incorporate them more often than not. So you're also butting up against these systems as you're trying to advocate and be involved, that are pushing you out, or not opening the door to you in the first place. And so a lot of what we're talking about in our groups are how to engage and how to support, or how to be a partner to a veteran who is reluctant to seek care or who is facing some of these barriers, and what they can do, how they can understand what is PTSD, what is partner accommodation. We talk about that in our groups, right? Like, when is it helpful versus hurtful? and really arming them with that information to be able to not only support their loved one who may be struggling with these things, but also support themselves while they're in a relationship with a person who's struggling, because that takes a toll. And if they're not taking care of themselves, it's making the whole family unit struggle more. You can go to the next slide. I'll be really quick with this. So like, what are we doing to support, these family members in this? The biggest thing that we try to do, and this is kind of, as we think back on research too, is how we approached research, is involving the community and identifying like really and engaging in the research topic, or in our case, more often than not, program development. So really ensuring we're engaging them at every step, development, implementation, evaluation, to understand what are their needs and how do they want those needs addressed? And then is this working, right? And what is their feedback? And using those data points to then improve programs. Because so often research, program development, it's like, I have this idea or I have this question, I'm going to go solve it. But it doesn't mean it's the right question or the right solution or the right program for that population. So that's something that's core to our philosophy, and that I think is really helpful. As we discuss here in a moment, like how to kind of incorporate and address some of these things, is making sure that the community is involved in helping figure that out. Because if it doesn't work for them, it's not going to work for them, plain and simple. And so that's our approach. We primarily, like I said, do peer support to really address all of those types of topics and help them have those conversations in safe spaces with those who are walking that path, to say, no, you're not crazy. Yeah, I also do all the grocery shopping, and I thought I was doing the right thing, but now I'm realizing like now they're never going to go grocery shopping. And be able to have that conversation about, oh, well, this is what partner accommodation is. Yes, of course, you're the most, like, that's so well intentioned. You had the best intentions, but here's why that's happening. And be able to just provide those spaces with that information, those resources, from people that they trust, because they're walking this path too. And then we do a lot of education and specifically suicide prevention training, because spouses and family members are at the front lines. They're the ones at home seeing these things. So they need to know how to notice warning signs and symptoms, and they need to know what to do with that. And they need to know what to do with it in an approachable way, right? A way that works for me as a civilian, not a clinician. How can I intervene? How can I look out for my loved one? So we bring in a lot of experts. We had Dr. Nason do one of our seminars, I think last year, on different topics. And then we do a lot of like mental health first aid training, conversations on access to lethal means, safety planning. That's all really with like the civilian family member in mind. What is realistic for them to implement with their loved ones at home? And you can go to the next slide. And, oh, I did a horrible job editing that slide. I just cut my husband out altogether, poor guy. But what I wanted to be able to say too, and I'll probably stay short here and just let you guys know personally, I'm an open book. So as we're engaging in discussion here in a moment, like, don't feel weird if you want to ask me about my own experience. I've been with my husband almost 10 years. Again, he served in the Marine Corps. He has a PTSD diagnosis. He has dealt with suicidal ideation and attempts. And when I met him, he told me on the first day we met that his previous girlfriend had broken up with him. And I don't know if cursing on here is possible, so I won't do it, but like said, F you and your PTSD. And that's how she left it. And that was one of the first things I had learned about him, which is a weird thing to do. So I thought I knew what I was getting into. And I thought as a social work master's level student, I could handle this. But I really knew nothing about this community, what it meant to be a Marine, what it meant to have PTSD. And in the first 3 years of our relationship, we struggled a lot because he was not He was not really aware of what he was going through, and I was very unaware of how to support him. And when I looked for peer support, there was none. And I had no one in my life. I was getting the, why are you putting up with this? You should just leave. And I was like, no, I know other stuff is going on, and I want to figure out how I can support him and how I can support myself. And I think if I started this job about a year into meeting him, and I think without this job, without this community, I don't think we'd be where we are today, which is about to have our second kid. So testimonial wise, like I understand the power of these types of engaging spouses and connecting them with peers and engaging them in care and helping empower them to understand what their loved ones are going through. So I'm an open book for anyone who wants to ask questions. And then I think our last slide is just like, if you're interested in learning more about us, how you can connect with us. But I want to leave plenty of time for us to have discussion.